In today's episode of the Pathway Presents podcast, I got a very interesting guest here with me today. I'm with Connie O'Donnell, who is hailing over as a head of strategic marketing over at Fluidic Analytics. And today we want to really deep dive into what Fluidic Analytics is all about, who they're serving, but also how Connie's thinking about goals in that very interesting industry. So welcome to the show.
Hi.
Very good. So Connie, maybe give us a brief overview. What is Fluidic Analytics all about in your own words?
Yeah, thank you. So Fluidic Analytics is a company that produces technology at the root of it. And that technology measures protein interactions. So we're really looking at how one biomolecule, normally a protein, as indicated by the name, interacts with another biomolecule. So that could be another protein, or it could be DNA, RNA, something along those lines. And why that's important is because it informs us, as say, how molecules behave with each other in particular systems. So, for example, say your first molecule is a drug of some description, and your second molecule that you're measuring how it interacts with is a drug target. Well, if we can measure that kind of in serum, it means we can look at how that drug is acting on the drug target in the patient's blood.
Mm-hmm.
So that means obviously it tells us a lot about how that drug might perform, whether that drug is going to be something which might pass a clinical trial, and obviously ultimately it helps the pharmaceutical industry work out whether that is a viable option for them.
Gotcha. That gives us a clear overview. So now, who is leveraging the technology? Like, who are the people, who are the organizations, the institutions that are leveraging the technology?
So it's quite a wide range, I suppose. In kind of at one end, there's the academic institutions, right, who are doing that very, very early research, which will look into how systems work just in basic biology, how we understand how the human body works and how protein machinery works. All the way through to people in pharmaceutical companies who are doing drug discovery, drug development, potentially even on the way to kind of antibody production, as well as biotech companies themselves, like us, who are producing technology which leverages protein machinery in what they're doing. So
Mm-hmm.
those are the people, I guess, that use the technology. But then when we think about who gets the benefit from that, obviously, hopefully, it's always the end patient, because if we are increasing the efficiency of drug discovery, maybe we're increasing the efficiency of clinical trial success, then ultimately that's going to benefit everybody who might be the recipient of a drug at some point in their life.
Mm-hmm. And, how would you say do these organizations learn about you guys? Like, what's their journey like of, let's call it the buyer's journey of how they, learn about you guys, hear about you, and then getting in touch to get started?
Yeah, it's a really interesting question, because the scientific industry is obviously one that is slightly tricky sometimes to get into. So for us at the moment, the biggest ways that we get interaction are mostly via conferences, especially academic and pharmaceutical ones, and also a degree of social media. So LinkedIn actually works very well for us as an organization in this particular industry.
Mm-hmm.
I know for a lot of other organizations, potentially LinkedIn is a little bit too formal and they have to be more on the kind of consumer side of social media. But for us, as I say, conferences and LinkedIn work very, very well. That, and then obviously anything through publications, third-party science providers where people would normally find their information that allows them to do their job as a researcher. If we can find some way of getting in there, then that obviously increases our exposure and also credibility within that field as well.
Now, what role does then a website play in this journey? Like, because for a lot of technology companies, the website is the core of the journey. Like, how do you think about that in your scenario?
Yeah, it's a very interesting question, because we find at the moment our kind of inbound level of business is relatively small. And obviously that's something that I want to change, right, as head of marketing, and get to the point where we're receiving much more business than necessarily we're going out and finding.
Mm-hmm.
So that means that obviously we need to do a degree of kind of SEO, and we need to get it really in front of the right target audience. And that's one of the biggest challenges, is making sure that the fit of who we're reaching is right for the product. But then coupled with that, there's a saying in scientific marketing that your marketing should be almost so good that somebody would pay for it, because scientific kind of exchange is all about knowledge. And if you can provide that knowledge via the website, if you can provide people tips and tricks and how-tos, then you're much more likely to get that kind of traffic. So that's going to be one of our primary objectives, I think, is increasing that amount of content and that type of content so that we're receiving that information and we're providing value to the viewer.
Mm-hmm. And what have you learned or picked up over the years as a marketer now? And obviously you've been in very sort of technical products. Like what helps when it comes to drive conversions on those types of websites? Like what's really important? Is there a certain approach, a certain method? Is it very different than let's say a typical SaaS or software product conversion that you want to drive? How do you think about that?
Yeah, so it's a very kind of slow sales cycle. With a really high touch point number, generally speaking. You can even find people, if you have a noodle around whatever your kind of CRM databases are or whatever is tracking on your website, you can find people that, for example, have viewed pages 280 times, right? Like just huge numbers, because the level of research that is required to go into that kind of purchase is obviously quite substantial. So providing people with enough content that they can actually make that decision and that we're funneling people really effectively from that initial awareness through all the way to the kind of evaluation to the point where they can almost make that purchase, before they actually speak to the salesperson, is a big challenge. So A, we have to develop a lot of content. B, it has to be obviously technically specific enough that people feel that level of confidence to actually go down that route, send off for a quote, talk to a salesperson. But I think also one of the biggest things I've learned is that in this scientific field, it really can lead to paralysis, right? So you're trying really hard to get that really perfect piece of content that will absolutely drive that buyer decision. But it can lead to you just never getting it out if you really focus too much on it. So as I say, although providing enough content for that funnel is really, really important, it's not so important that it means that you then don't get anything out because it doesn't meet your standards, really, I suppose.
Got you. Oh, very, very good. That makes a lot of sense. Now, I would like to switch gears a little bit, right? We talked about what you guys are doing. We talked about the growth channels. We talked about the specific role of the digital channels. Now, what I would like to do is touch a bit on basically your journey as a marketer. As I mentioned, you've been in very sort of technical products so far. Where do you personally like to educate yourself as a marketer? Because maybe a lot of things that are out there in terms of like blogs and stuff might not necessarily really apply over to your scenario. Like where do you personally enjoy to, research and study marketing best practices?
Yeah, that's a very good question. I think that one of the crucial things that we, as in the scientific marketing industry, can do is learn from the consumer industry, because quite often, because the sale is very different, we have to really, really think very hard about whether the fit is right, as I've said already, and that customer is right for the technology. Whereas more in the consumer industry, you might convince a consumer that the fit is right for them. We can tend not to learn those lessons from the consumer industry, right? Because we think it doesn't really apply. I like to try and challenge that as much as I can, I suppose, and really look at especially things like the food and drink industry, where their turnover and their customer number is huge, and really think about the strategies that they're doing to, I suppose, get that brand awareness on a much larger scale than we do in the scientific industry, because I think there's a lot, I think there's a lot that we can do there to really challenge whether the ideals that we hold about scientific marketing are accurate. So I suppose in a way, for my own learning, in a lot of ways, it's quite a lot of the traditional places that you might hear. HubSpot do fantastic, articles and fantastic tutorials on all the different techniques that you can do. There are some more scientific ones as well, like ASO Network, but as I say, my primary learning, I guess, comes from the consumer industry.
Gotcha. Very good. Now, I got some rapid fire questions to wrap it up for today. Are you ready for those?
Just about.
Very cool. So what would you say is the last book that you read?
Oh, the last book that I read was actually A Midsummer Night's Dream by Shakespeare, if that counts, because I'm playing one of the characters in my local production.
Nice. What's the one single thing that your company is focused on the most at the moment?
Getting into the pharmaceutical industry, I guess. this is a slightly longer answer, so I apologize, it's not that rapid fire. But if you think about the adoption curve of technology, with the kind of early adopters right on the left-hand side, and then the more laggardy, the less confident people to change on the very right-hand side, pharma sits right over there. And so when you introduce a technology, it's very hard to kind of skip to the end. So thinking about strategies that we can do that is probably one of the biggest things that we need to do right now.
Mm-hmm. If you would have a magic wand, what's the one single thing that you would fix for your role as a marketer?
Oh, I would love to have a really easy way to get in front of the eyes of some of these scientists that do really obscure projects and you can't find a way to get to them at all. If I could, wave a magic wand and be right in front of them with our marketing, that would be ideal.
And for the very last question, I'd like to ask you if today would be, so let's do a little bit of time travel. We go back to the days of Lancaster University, right? You're heading out of formal education into the world of, marketing for that matter. What would be the one advice that you would give yourself for that journey?
Excellent question. I think that I would tell myself to just go with it. I think this was quite a surprising career that emerged for me. I started off as an intern. I had ideas that I would be a scientist, turned out to be pretty useless at it, and spent a bit of time resisting going into the commercial world. And actually, it's the best decision I've ever made. And so, if I could tell myself one thing, I think it would be to just relax and just enjoy it, because it is really good fun.
I mean, it sounds like you found a very good mix between the two, actually.
Yeah.
Very cool. Connie, I really appreciate you took the time with us today to be a guest on Pathmark Presents. I want to give you the very last word. If somebody would be forgetting all that we discussed about Fluidic, what's the one thing people should remember?
Oh, they should remember that protein interactions are the next biggest thing we can do to help human health. And we provide the technology that will help them do that.
Thanks a lot for being a guest on Pathmark Presents.
Thank you.